Hey beautiful people, welcome back to my channel once again with part 2 MCQs of quality control, safety and lab ethics. So today we are going to discuss remaining 15 MCQs. So before starting the video, I would like to request you to please like, share and subscribe to my channel. Keep supporting me and let's get started with our today's video. So friends, our 16th question is the process by which an agency or organization uses predetermined standards to evaluate and recognize a program of safety in an institution is called option A regulation, option B licensure, option C accreditation and option D credentialing. So the right answer is option C. Accreditation is must for a agency or organization, any of the organization, right? So option C accreditation is the right answer. Moving on to our 17th question, a paper or electric report of lab results must include option A name of the person who collected the sample, option B the test price, option C a pathologist signature and option D the name and the address of the testing lab. So the right answer is the name and the address of the testing lab is must on the printed or electric report of a lab result. Okay friends, moving on to our 18th question. 18th question, refer the following illustration. The symbol indicates which of the following hazard? Option A flammable, option B electrical, option C radiation and option D biohazard. So the right answer is answer A flammable hazard. So friends, for finding these different kinds of biological hazard, you can visit my channel. You can see one of my videos containing all the different types of biochemical, chemical, physical hazards. There you can find every type of hazards you will come to know. So they may ask the questions based upon these symbols also. So once you go and please visit my video, so that you will be thorough with all the different kinds of symbols used in the laboratory. Moving on to our 19th question. For safe operation of a centrifuge must option A clean with soap or detergent when maintenance is performed or spill occurs, open the centrifuge cover when it is in the process of slowing down, option C leave liquid specimen tubes uncovered during centrifugation, option D ensure proper balance is maintained. So the right answer for the safe operation of the centrifuge is option D, ensure that proper balance is maintained on both the sides. Okay friends. So friends, our 28th question is all laboratory instruments should be option A have repairs conducted while connected to facility wiring, option B be grounded or double insulated, option C have safety checks performed initially and then for every 6 months, and option D be connected to multiple outlet adapters. So the right answer is option B, that is be grounded and double insulated. Moving on to our 21st question. A technologist splashed a corrosive chemical in his or her eyes to prevent permanent injury. The first action should be option A bandage the eye and seek immediate emergency, option B flush eye with a chemical of opposite pH to neutralize the injury, option C use the eye wash station to flush eyes with water for 15 minutes, and option D rub the eyes. So the right answer is option C use the eye wash station to flush eyes with water for 15 minutes. So friends, as you know, here we are using eye wash. So eye wash is also a mandatory kit to be present in every lab. Moving on to our 22nd question. Safe handling and disposal of laboratory generated infectious waste required. Option A disinfection of all waste, option B thorough mixing of infectious and non-infectious waste. That is friends, now that is non-infectious, sorry, have mistaken is as now. Option C separation of infectious and non-infectious waste, option D incineration of all waste. So the right answer is option C separation of infectious and non-infectious waste. This question is again from biomedical waste management. Okay friends, coming to our 23rd question. Which of the following forms of exposure places a technologist as the highest risk of infection with HIV virus? Option A aerosol inhalation, example AIDS patient sneeze, option B ingestion, example mouth pipetting for positive serum, option C needle stick, example from AIDS contaminated needle, option D splash, example infectious serum split onto intact skin. So the right answer is option C needle stick. Here the question arises from needle stick injury. From this needle stick injury, the technologist is having the highest risk for infection with HIV virus. So to avoid the needle stick injury, use proper gloves and you should never recap the needle. Okay friends, moving on to our 24th question. Use of standard universal precaution minimizes exposure to option A bloodborne pathogens, option B chemical hazard, option C radiation hazard, and option D environmental hazard. So the right answer is option A bloodborne hazard. Universal precaution minimizes. What we are using universal precaution is gloves, mask, apron is our universal precaution which we are daily using. So this can by the use of this avoid the bloodborne pathogen, exposure to bloodborne pathogens. Moving on to our 25th question. After an accidental needle stick with a contaminated needle, the first action should be, if you by mistakenly got a needle stick injury, what will be the next step you have to do? Option A apply antiseptic ointment to the wound, option B seek immediate medical assistance, option C bandage the wound, and D thorough wash the wound with soap and water. So the right answer is, if you are getting a needle stick injury, option D, that is thoroughly wash the wound with soap and water, and you have to follow the report. The patient needle which you have been injured, you have to follow the report and you have to see the result also for your satisfaction. Okay friends, moving on to our 26th question. When processing specimens for mycobacterial testing, what specific engineering control must be used? Option A horizontal laminar flow hood, option B barrier protection only, option C biological safety cabinet, and option D fume hood. So the right answer is option C biological safety cabinet. The question is arising from, as we have discussed biosafety levels, right? Biosafety level 1, 2 and 3, 1, 2, 3, 4. So here in biosafety level cabinet BSL 3, you are having this one, what, mycobacterial testing specimen, that is biological safety cabinet must be used while handling with mycobacterial testing. Moving to our 27th question. When cleaning up a small blood spill on the countertop, the first step after donning appropriate personal protective equipment is to option A flood the area with an appropriate high level disinfectant, option B observe the spill with disposable absorbent material, option C evacuate the area for 30 minutes, and option D clean the area with an aqueous detergent solution. Here the question is arising from spill kit. Right friends, as we have discussed regarding the spill kit. So the right answer is answer B, absorb the spill with disposable absorbent material. Moving on to our 28th question. This symbol represent option A biohazard, option B radiation hazard, option C chemical hazard, option D environmental hazard. So the right answer is, this symbol will represent the biohazard one. So friends, once again I am reminding you that to know all the different kinds of hazard and their symbols and their respective names, please do visit my video which is uploaded specially on only biohazards which are used in our medical labs. Moving on to our 29th question. This symbol represent option A biohazard, option B corrosive, option C chemical hazard, and option D radiation hazard. So the right answer is, this symbol will represent option B corrosive one. Moving to our 30th question. Infection rate is highest for laboratory professional exposed to blood and body fluids containing option A hepatitis A, option B hepatitis B, option C CMV, that is cytomegalovirus, and option D HIV, that is human immunodeficiency virus. So the right answer is answer B hepatitis B. So as you all know that every medical staff should be vaccinated with hepatitis B virus as to avoid these kind of infection, right? So these are the remaining part 2 MCQs from quality control, lab ethics and safety. Hope you like it. So please like, share and subscribe to my channel. Keep supporting me. Thank you friends.